Bismillahirrahmanirrahim. Today's practical is about emphysema. What is emphysema? Emphysema is basically the abnormal permanent enlargement of the air spaces distal to the terminal bronchioles, and it is accompanied by the destruction of their walls and without obvious fibrosis. Spaces in air parenchyma is greater than 1 mm. We can call it abnormal. Then the classification of emphysema, we have the centriacinar, Panacinar, Paraseptal and Irregular emphysema. This is the centriacinar or centrilobular emphysema, which is showing only the distal part is involved. Only the proximal part is involved while the distal part is spared. In panlobular emphysema, all of the alveoli and the acini is involved. In paraseptal, only the distal part is involved. In irregular emphysema, there can be distal and proximal part. So, what is the central acinar emphysema? It is centrilobular and proximal acinar. Dilatation of the respiratory bronchioles, most common in upper lobes and can coexist with chronic bronchitis, and most common in the smokers and chronic smokers and heavy smokers, and can occur in coal mine workers, for example, the workers who are working in carbon and dust factories. Then we have the panacinar panlobular emphysema. In this emphysema, the acini are uniformly enlarged from the level of the respiratory bronchiole to the terminal blind alveoli. It is more commonly occur in lower zone and anterior margin of the lung. And it is commonly associated with alpha-1 antitrypsin deficiency. Then we have the paraseptal or distal acinar. In this, the proximal portion of the acinus is normal, but the distal part is involved. More common adjacent to the pleura, along the lobular connective tissue septa, and at the margin of the lobule. It's more common in upper half of the lung. Then we have the irregular or mixed type emphysema. It's most common but least significant, and it is most common around the scar tissue, and it's combination of an acinar panacinar emphysema. Then we have the gross feature of emphysema, in which the pan-acinar emphysema, when well developed, produces voluminous lung and often overlapping, which is the lung overlapping the heart. Then the feature of the central acinar emphysema are less impressive. Generally, the upper two-thirds of the lung is more affected. Large apical bulbs or bullae are more common characteristics of irregular emphysema secondary to scarring. And this is the emphysema showing the bullae. And what is the bullae? It's a subpellular air-filled cystic areas greater than 1 centimeter and most common in anterior margin in apex. And its complication it can cause rupture and pneumothorax. Then we have the microscopic features. On microscopy, there are abnormal fenestration in the wall of the alveoli, and there is a complete destruction of the alveolar wall. In advanced diseases, distant alveoli fuse, forming gloves in bullae. The respiratory bronchioles and vasculature of the lung deformed, and compressed emphysematous distortion of the air spaces occurred. And this is the diagram of emphysema, and this is a diagram you have to draw in your practical notebook. This is showing the dilated alveoli. This is the blood vessel and intervening septum. Then the clinical feature of the emphysema, patient can present with dyspnea, cough, wheezing, loss of weight and peptic ulceration, and there can, on examination, we can find the barrel chest. Then the treatment, we can give the bronchodilators, steroids and antibiotics and mucolytics. Mucolytics are the drugs which are used to treat the mucus. Then we can go for oxygen therapy, and then the vaccination. In vaccination, we can go for the vaccination of the pneumonia and flu shots. Then surgery, we can have the lung volume reduction surgery. We have the option of bulectomy, and we can go for lung transplant in severe diseases. Thank you so much, students. I am repeating This is the diagram, and it is showing the dilated alveoli, blood vessels, and intervenous septum. You have to draw in your practical notebook. Thank you so much.